Alex, you guys have been, Shola talked about using project-based vouchers to aid in the development of affordable and supportive housing. I know that the Rochester Housing Authority has done that as well, and you've actually now developed some innovative ways of working with HCR to make sure that the projects you're looking at are the ones that they're looking at too. So could you tell us about, maybe a little bit about what you've done in the past and what you're doing now?
Well, in the past, we asked developers to respond to an RFP process. So that, obviously, there was a cost associated with that for us. Also, not only the RFP, but the review of the RFP. And then once we determine who will move forward, then the developer will still, those not chosen will still go through New York State. And what we used to see is that just because we picked certain developers, they didn't necessarily get the vouchers from HCR. So what we realized it was that what we thought, meaning we had control to decide what was happening, it was just the perception of control. And as soon as we realized that what we had was the perception of control and truly New York State had the control, it was very easy to make a phone call and say, you know what, why are we going through this ourselves with lack of resources that we have? Also putting the the developers through this on an annual basis. Why don't we agree and combine our process together? So this was the first year we did it. It went extremely, extremely well. There was a lot of folks that were a little nervous, especially developers, because they didn't have that agreement from us. But that avoided us from having things such as, every year if a developer got approved by us, but not by New York State, they will ask for an extension. And if they didn't get it next year, they will ask for another extension. And before you know it, you're not only doing public housing, you're doing Section 8, but you're doing also an extension program on developers. And you start needing staffing to deal with those things. So what we realized is, let's try this out with New York State. The first year has gone great. I know that New York State liked it as well, so they're trying to spread it to other communities as well. But I can say we are... The investment our return on investment was significant. We barely spent any significant amount of time going through the process, and still, New York State was able to go through the process successfully. So.
Well, I think, again, I mentioned when I was introducing Alex that the Rochester Housing Authority is one of the more innovative in the state. The fact that the Housing Authority had a program whereby they were trying to award project-based vouchers to deals getting funded by the state through its tax credit round speaks volumes. There aren't a lot of housing authorities that do that. As Shola talked about, NYCHA and HPD coordinating, obviously the state of New York covers the rest of the state, and I don't know of another housing authority that thinks about that with their voucher program. You can sometimes approach them and ask them for some Section 8 vouchers, and you might be successful. But the fact that Rochester was making that offering every year and now is taking another step further to say, we want to coordinate with the state so that we're only making commitments where the state is willing to make the commitment of their funding resources, and it all comes together. So I think it's a really great statement about the thinking of the thinking of the authority, but also coming up with an innovative way to do it even better. So Shola, we'll go back to you. One thing that is, I think a lot of people in this room would view as a big victory is the change in policy on homeless preference. So if you could just tell us about where that stands.
Sure. So, I think it is a significant shift given 12 years. And the data all suggests that, the two things that prevent families from experiencing homelessness are the presence of a public housing unit and or a Section 8 voucher. And since we don't have a lot of Section 8 vouchers, we were pleased to be one of the tools that this administration has put on the table to address the city's homelessness crisis. In what was my second week, I was summoned to City Hall to really begin a process that we are still engaged in with our DHS colleagues, with our City Hall colleagues, with our HRA colleagues, to really think about how we could be a part of a toolbox, really, to address, the crisis of 52,000 people in shelter every night. And so at this point, we have committed approximately 3,200 units of public housing over the next 4 years, actually committing 1,000 units in the program initiative's first year to homeless families. And our teams, DHS and NYCHA's teams, worked really closely to really match families, because not surprising, a number of families that are on our waiting list are also within the DHS system. And really, and again, I think another example of the way that we're working differently is that, that was a process that happened really quickly. So, we have committed those numbers. We are working through the sort of programmatic elements. I think we all believe and are committed to the provision of supportive services for these families as well, so that we are situating families for success in our developments, which is critical for us as a landlord, that folks have the services if needed, and that's there. And I will say, Commissioner Taylor and I have each other's cell phone numbers on speed dial, and really are working really closely to make sure that's a reality. But it's clearly, within the context of the need, a small piece, but
Sure.
Again, we're very pleased to be a part of one of the tools that this administration is putting forward to address this issue.
That's great. JoAnne, back to you, and it actually ties in. We've heard a number of people today throughout even the morning plenary and at various workshops talk about moving on. And it is, I actually don't recall if it was specifically mentioned in the mayor's housing plan, but I know it's something that the city is talking about, and people at a lot of different levels in the city are thinking about. So could you, I know you've given some thought to this, and maybe you could give us some insight into what you think needs to be done in that area and where the efforts are going to take us.
It's actually something I'm fairly passionate about, because supportive housing in its most intensive form is really expensive and really scarce. And we have too many people who stay in it beyond the point where they need to be in it or want to be in it or should be in it. And just to tell you the experience that we had with this in the castle, we originally got funded by HUD under an innovative model that we called phased permanent housing. And the idea was that people would be straddling being homeless and being housed, so they would still be eligible for rent subsidies when they were ready to move out. And we were told, no, you're permanent housing, which means they're not eligible for rent subsidies. And I said to HUD, do you mean you want us to house fewer people at greater expense for longer than they need to be in the most expensive services? And they said yes. So what we ended up doing was fighting about it and becoming called transitional. And that leaves them eligible for shelter plus care vouchers that let them move out at a fraction of the cost of staying in our housing longer than they need to be in congregate care. But I think having models that are more flexible, that really are person-based, and that don't hold people to greater dependency than they need is really important.
Yeah.
So I think that there's a danger if the city and the state stick with the rigid definitions that we're seeing at the federal level. And I think that encouraging flexibility and thinking about subsidies as a way of freeing up the more expensive commodity of in-depth supportive housing is really important. But there's another piece to the moving on, and that is that if you're dealing with people who have life challenges that aren't going to vanish, whether it's mental health or long-term substance abuse, it doesn't go away. And one of the reasons we can move people out is that we make a lifetime commitment that if they need to come back, they get priority over everybody else. Because if they decompensate, if they relapse, you don't want them going back to incarceration and to homelessness. So that idea of moving people along, but knowing that sometimes it's not a one-way street, and sometimes they need to loop back. And we're finding that sometimes people need that second or that third time. We've evolved the model following our clients. Sometimes that's what it takes, and that you can't give up on people if they screw up the first time, because as one of our founders says, the problem with people with problems is they act like people with problems.
Yeah, and one of the things that I've also heard folks in the city talk about is, really aftercare. So if you're going to do this, it's not just a matter of, okay, you've moved from this facility to over here and you don't need any services anymore, but really keeping in touch with them and making sure that they're getting whatever they need to be successful in their new residence as well.
And the room to ramp up if people need
Yeah.
it, and to pull people into greater supports if they need it,
Right.
so that when they're ready to move on, they can move on. But if they start slipping and sliding and need to move back, you're not just dropping them and going on to somebody else.
Right. And yeah, Shola, please.
I would add, NYCHA we have approximately 150 people who focus on family services. So any kind of intensive need that a family might have, that's clearly not enough people to do that. And so I think another part of our plan needs to be a sustainable model in which we are more partnership based in terms of being a connector of two best-in-class partners, within the industry, so that we can utilize our resources to ensure that buildings are fixed, roofs are fixed, et cetera, but to also ensure that there's a true connection and pathway for services that people might need, both to remain stably housed within NYCHA, or should they need to move on as well.